All right. And we are back. Just when you thought things were getting weirder and stranger, here we go. Biden picks transgender physician Rachel Levine as Assistant Health Secretary. Pennsylvania Health Secretary Rachel Levine is poised to become the first openly transgender federal official to be confirmed by the U.S. Senate. In Washington, the president-elect Joe Biden has tapped Pennsylvania Health Secretary Rachel Levine to be his Assistant Secretary of Health, leaving her poised to become the first openly transgender federal official to be confirmed by the U.S. Senate. A pediatrician and former Pennsylvania physician general, Levine was appointed to her current position by Democratic Governor Tom Wolf in 2017, making her one of the few transgender people serving in elected or appointed positions nationwide. She won past confirmation by the Republican majority Pennsylvania Senate and has emerged as the public face of the state's response to the coronavirus pandemic. Dr. Rachel Levine will bring the steady leadership and essential expertise we need to get people through this pandemic, no matter the zip code, race, religion, sexual orientation, gender identity, or disability, and meet the public health needs of our country in this critical moment and beyond. Biden said in a statement, "She is a historic, it's not a she, it's a he, is a historic and deeply qualified choice to help lead our administration's health efforts." A graduate of Harvard of Tolman Medical School, Levine is president of the Association of State and Territorial Health Officials. She's written in the past on the opioid crisis and medical marijuana, adolescent medicine, eating disorders, and LGBTQ medicine. Biden and his transition team have already begun negotiating with members of Congress promoting speedy passage of the president-elect's $1.9 trillion plan to bring the coronavirus, which has killed nearly 400,000 people in the United States, under control. It seeks to enlist federal emergency personnel to run a mass vaccination centers and provide 100 immunization shots in his administration's first 100 days, while using government spending to stimulate the pandemic-hammered economy. Biden also says that in one of his first acts as president, he'll ask Americans to wear a mask for 100 days to slow the virus's spread. Oh, boy. Right. Mass vaccination centers. Peddling that vaccine that doesn't hurt people, but sure does kill people. Levine joins Biden's Health and Human Services Secretary nominee Xavier Becerra, a Latino politician who rose from humble beginnings to serve in Congress and as California's Attorney General. Businessman Jeff Zients is Biden's coronavirus response coordinator, while Biden picked infectious disease specialist Rochelle Walensky to run the Centers for Disease Control and Prevention. Vivek Murthy, a Surgeon General, and Yale epidemiologist Marcella Nunez-Smith to head a working group to ensure fair and equitable distribution of vaccines and treatments. The government's top infectious disease expert, Dr. Anthony Fauci, will also work closely with the Biden administration. Oh, great. Oh, joy. Oh, joy. Oh, happy day. Oh, happy day. But let's look into Rachel Levine, shall we? Let's look into this person. All right. Here we are. Okay, and here's something that kind of disturbed me, okay, with the COVID-19 pandemic. As the State Secretary of Health, she leads the public health response on COVID-19 in Pennsylvania. She works closely on a daily basis with the FEMA director and leads a daily press briefing. Levine was accused of removing her own mother from a personal care home after creating a policy whereby nursing homes throughout the Commonwealth will readmit residents testing positive for coronavirus after they declared healthy enough to leave the hospital. Levine has stated that personal care homes, as opposed to nursing homes, do not fall under the jurisdiction of her own agency. Now, let me get this straight. So you save your loved one, you remove your loved one, okay, from a personal care home after creating a policy, right, that would readmit residents testing positive coronavirus into personal care home, okay, that's gonna spread and kill other senior citizens. Self-preservation much? This right here shows that this person will, do what they can for their family, make everybody else follow a certain way of rules, but for their family and whoever's close with them, another set of rules for them. The fact that, this person is a trans woman and is in charge of the health field, okay, a particular health field, that is not a good thing to know. Because we all know that the LGBT wants to basically reinvent the wheel when it comes to genders. Okay. We know that. Okay. And unfortunately, no matter what they want to be thought of or how to be referred to with pronouns, when it comes to the health field, health matters, and the correct terms matter, because without knowing the correct term of a person, male or female, you won't be able to deal with whatever the issue is. Okay, like if a trans man is pregnant, and the thing is, like, they're going through a hormonal process to look like a man, but they forget to take their pills and they end up having sex with a woman and getting pregnant. Okay, then the person doesn't know. What I'm telling you is a situation that actually happened, that was reported in the news, and the baby ended up dying because the person wanted to be referred to as a he instead of a she. Okay, and the fact that they refer to this person as a she instead of a he, Rachel Levine, who's really a man. Imagine this person being in charge of a particular part of government, which, pertains to health. Okay. Let me move this, and I'm going to bring up a part of the duties of the Assistant Health Secretary. Okay. All right. Here we go. Assistant Health Secretary for Health. Assistant Secretary for Health serves as the U.S. Secretary of Health and Human Services' primary advisor on matters involving the nation's public health, and if serving as an active duty officer in the regular corps, is the highest ranking uniform officer in the U.S. Public Health Commission Corps. Oversees all matters pertaining to the U.S. public health, the main division of the U.S. Health Department of Health and Human Services, and the Secretary, and provides strategic and policy direction for the Commission Corps. PHS comprises of almost all the agency divisions of the HHS, as well as Commission Corps, a uniform service of more than 6,700 health professionals who serve at the HHS. Other federal agencies and or assigned details to the Armed Forces, the ASH, Assistant Secretary for Health, a civilian or a uniform officer of the regular corps, and is nominated for appointment by the president. The nominee must also be confirmed by the Senate. Assistant Secretary of Health serves as a 4-year term of office at the pleasure of the president. If the appointee is also serving a uniform officer of the regulatory corps, he or she is also appointed as a 4-star admiral in the regular corps. The president may also nominate a civilian appointee to also be appointed a direct commission in regular corps if the nominee so chooses. As such, as the position Assistant Secretary of Health is only office is in the PHS that merits a 4-star grade in regular corps. Since the Assistant Secretary's office and staff are known as the Office of Assistant Secretary of Health. The position of Assistant Secretary for the Health is currently vacant. It's not vacant anymore because Biden chose a trans woman to be a part of that. This is something that is should be something to think about, because what Biden is doing. It's not something that is just something that is going to make your eyes roll, and you're going to have to be wondering about the new policies that are going to come out. That's another thing you're going to have to worry about. What are the policies? What are the changes that's going to be made? What is this person going to be making changes of? I already told you what this person did. All right. And Biden wanted to put this person in a position of power. That's going to tell us what to do. And also with this mass vaccination that they want to enforce. All right, that's all I got to say. If you like the comment, you like the content, like, share, comment, and subscribe. Later. Now we know what Biden had in his mind on this Declaration of Independence speech when addressing God as you know, the thing. Well, I mean, both sides are dirty. Trump and Biden are dirty. Trump was a slow walk to the NWO. Biden is a sprint to the NWO. Welcome to global communism as we know it. All right. Like, share, comment, and subscribe.